Bronchitis. Bronchitis is an inflammation or swelling of the bronchial tubes, bronchi, the air passages between the nose and the lungs. Caused by viruses, bacteria, and other particles that irritate the bronchial tubes. There are two types of bronchitis: acute bronchitis, chronic bronchitis. Characterized by a persistent, mucus-producing cough on most days of the month, 3 months of a year for 2 successive years. Etiology and risk factors. People who are exposed to a lot of secondhand smoke. People with weakened immune systems. Smokers. The elderly and infants. People with gastroesophageal reflux disease, GERD. People who are exposed to air pollution. Signs and symptoms. Inflammation or swelling of the bronchi. Coughing. Production of clear, white, yellow, gray, or green mucus, sputum. Shortness of breath. Wheezing. Fatigue. Fever and chills. Chest pain or discomfort. Blocked or runny nose. Diagnostic evaluation. History collection. Physical examination. Chest X-rays. Sputum cultures. Spirometer exercises. Bronchoscopy. Medical management. Antibiotics. These are effective for bacterial infections, but not for viral infections. They may also prevent secondary infections. Cough medicine. One must be careful not to completely suppress the cough, for it is an important way to bring up mucus and remove irritants from the lungs. Bronchodilators. These open the bronchial tubes and clear out mucus. Anti-inflammatory medicines and glucocorticoid steroids. These are for more persistent symptoms. Pulmonary rehabilitation program. This includes work with a respiratory therapist to help breathing. Watch, like and subscribe.